Balance is a growing concern for many of us as we age, and balance problems just really make it hard to maintain posture, really stand upright. It affects our walking and even sitting, just a lot of our daily activities. Hi, I'm Dr. Crockett, and this is Dr. Sanders with Zeal Integrated Health, and today we just want to talk about some of these balance issues that really affect the quality of life as we age. It's often common for these things to become issues, as we age into adulthood. So let's talk about, first of all, let's talk about some of the issues that balance problems come from. Let's talk about some of the things that drive this.
Absolutely. So we can look at some medical conditions that'll drive this. Obviously, a stroke. We always see after strokes, or most always see, some differences side to side.
Obviously, a sudden impact with
Yes.
something like that, it's immediate.
As with that, Parkinson's, you get lack of brain muscle communication, and then you start to lose balance that way.
Yeah, and this is obviously a little slower process that you see. I was just golfing this weekend with somebody that was dealing with Parkinson. It was amazing to see him out there still working those muscles, working the neurological pathways with an activity like that.
Yeah, one of the great things to do when you're dealing with that. Speaking of long-term things, MS, that slow degeneration of the nerves, that will cause a lot of issues as well. Traumatic brain injuries, obviously that can offset some things. People don't realize this, but arthritis, right? You start getting different joints degenerating over time, you'll get an imbalance there, and that will affect how you walk, sit, and stand.
Yeah. So a lot of these things come neurologically from the brain. So we see things like Parkinson's and MS and strokes. They're impacting neurology of the brain. Arthritis is affecting neurology from the joint side.
Yes.
So you start looking at things like proprioception of the joint. So the nerves have sensory items in the joint itself that are picking up the movements in the joint, and arthritis obviously impacts that, right?
Right. And speaking of that proprioception aspect, we also utilize the muscles that go over the joints and the ligaments as well. That tells us, that tight feeling we get, sometimes that will throw off our balance as well, especially in the neck and back, because we want to be standing straight up and down. If we feel like we're pulling to one side or the other, that will affect it as well. As well as more other common issues. You wouldn't think these right off the bat, but depression and blood pressure medications, two of the top prescribed medications, do have side effects of balance issues.
You drive somebody's blood pressure too low, obviously they're going to start getting dizzy. We start, that can obviously cause almost like a vertigo situation, but there's people that have issues with their inner ear driving vertigo as well. You see people get fluid in that inner ear, and all of a sudden they can't get out of bed, they can't function in their daily activities because of so much dizziness. You see diabetes drive things from a damage point to these nerves as well. So as sugars go high, the nerves throughout the body and the peripheral area start to get damaged, and they start losing that proprioception that we were just talking about, that feedback from these extremities back to the brain and controlling balance. So we see those things drive that, and then we get into some of the musculoskeletal stuff that you were talking about related to posture and stuff, muscle weakness, things like that.
Now, that's the big key. What we just talked about is trying to figure out what's causing the imbalances. There's so many different aspects, and finding someone that can find that for you is the first key. And then what we notice, and with our patients, is we're able to use the ProSoft, the ProSoft 360 to help get them moving again. That uses movement therapy to kind of re-educate that neuromuscular system and kind of adapt those joints back to a normalcy.
Yeah, just by putting impulses into the joint while the patient's actually moving those joints through a certain pattern, you're stimulating the neurology and increasing those abilities of the individual to fire that nerve pattern in a quicker and quicker manner. This is super important for preventing things like falls.
Absolutely.
And of course, as we age, we worry about osteopenia and osteoporosis and broken bones with these falls. So if we can speed up the neurology, and we can get those impulses to fire from the muscles and the joints to the brain faster, your brain can send those impulses back to those muscles and react to an imbalance in the ground, the surface that we're walking on, which is oftentimes what leads to that fall. They just can't react fast enough. Next thing you know, they're laying on the ground with broken bone. It happens so quick.
Absolutely. People don't realize that the nerves need to be exercised just like the muscles do. A healthy nerve gets bigger, it transmits signals quicker, and that does reduce falls. You can catch yourself quicker. Absolutely.
So if you're experiencing any balance issues yourself, give our office a call, and we can maybe get to the real why behind it. I think that's the first thing, is identifying what's causing it. and we can identify if maybe you would benefit from the ProSoft 360, using that software and that technology to actually, you know, work on balance and work on the neurology to maybe prevent you from having one of these life-changing falls as well. So don't forget to, you know, like, share, and follow us.